it's hormone replacement therapy, okay? So it is talking about replacing hormones. Or you come up against some people arguing against that, because you'll say you're not replacing what you shouldn't have in postmenopause. It's a bit of a debate. So anyway, HRT is hormone replacement therapy. So it's essentially replacing hormones that women are lacking, which are causing symptoms. I think that's probably the best way to put it. So in women so as a diagnostic process, as a doctor, we will listen to our patient, we will do any examination that's necessary, and we'll make a diagnosis, and then we will form a plan. Okay, so that management plan will be all those things we talked about, all the lifestyle interventions and everything. So the analogy that we use is the thyroid gland. So if I had an underactive thyroid gland, so if I came and I said, I'm putting on weight and I'm constipated, my hair's dry, and I'm falling asleep all the time, and I did a blood test and my thyroid function was low, then we would replace it with thyroid hormone. But that comes from the point of I've had symptoms, and then I've had a test that showed it's not functioning, and then I've replaced it. So hormone replacement therapy is the same. So there's only 3 hormones we talk about: estrogen, progesterone, and testosterone. Estrogen rather than estrogen. You'll think, well, they missed the O off the front, but they haven't. It's estrogen to just cover all 3 forms of estrogen that we produce. Same thing, you'll hear a lot about, you'll read a lot about progestogens, because for a long time we couldn't manufacture a natural form of progesterone. So there was all synthetic forms which are not progesterone. They're chemicals like progesterone, but they're not. So they're called progestogens. But we do now have natural micronized progesterone. So it's estrogen, progesterone, and then testosterone, which is also a female hormone. Those are the hormones that we're referencing when we talk about HRT. I will advise women of the additional benefits of HRT over something else that's just going to be for symptom control. So that will be women who start HRT within 10 years of their menopause or below the age of 60 have a reduced incidence of cardiovascular disease. Going forward, they have a reduced incidence of osteoporosis. There's increasing evidence that they've got a reduced risk of diabetes, of of dementia in some women. So as well as using it for symptom control, there's a role to be considered about long-term health prevention, promotion. So I'm looking at trying to prevent chronic ill health in women. So if you're looking at a disease prevention strategy, then that's the additional benefit. Whereas anything else is really just looking at symptom control. Some women who can't, because of reasons of previous estrogen receptor positive cancers or other health conditions, that can't take HRT, and then we'll discuss with them alternatives. So you can use some forms of antidepressant that will reduce hot flushes. There are other medications that are traditionally used for, actually one that's used for an overactive bladder that you can use sometimes. So they're all others, but they're not first line. So it's a nice guidelines say if a woman has symptoms as a result of her menopause, then first line treatment should be hormone replacement therapy. We only go to second line medications if they're contraindicated, and then we'll discuss the options with the women. Lots of women will already have tried, before they come to see a doctor, will already have tried a lot of things. So they've tried menopause supplements, they've tried vitamin supplements, so they've gone to the chemist or Holland & Barrett or whatever, and they bought, there's a plethora of supplements that are targeted to help women. Some women will report some benefit from them, but nice guidelines from 2013 stated that there's insufficient evidence to support their use, because there's no benefit above that you perceive with placebo. So the evidence today is that the response to those supplements is no better than you'd expect from placebo. So we can't say, well, we don't endorse them. We say to women, it's entirely up to you, if you want to try, but there's no evidence that they're of any benefit above a sugary tablet. The only supplement I'll recommend is vitamin D, because vitamin D is really important in the prevention of osteoporosis. Other than that's it. So advise vitamin D, get them to check the calcium intake, and other than that, I don't recommend any other supplements, because there's no evidence base that they make any difference.